afternoon, everyone. My name is Jill Feldstein. I'm the Chief Operating Officer of the Penn Center for Community Health Workers. And I'm excited to be here, to be an alum of the Innovation Center and to tell you a little bit about our story growing within this, through the support of the Innovation Center and within Penn Medicine. I want to ground our time together, like a lot of my colleagues, with a story about a patient. We'll call him Mr. Brenner. When we met him in the hospital, he was a 50-year-old man, and probably the most defining characteristic or defining moment of his life up until that point was that he had been in jail earlier in his adulthood. And that really set his life on a very particular course. When he got out of jail, like a lot of people with incarceration histories, he had trouble finding stable employment, and that period of time also caused him to be estranged from his family. As a result, by the time we connected with Mr. Brenner, he had come into the hospital 9 times in the 3 years before we met with him because of suicidal ideation. Unfortunately, Mr. Brenner's story is not unique. There are a lot of patients in the hot spot of West and Southwest Philadelphia, our very own backyard at Penn Medicine, who have similar experiences as Mr. Brenner. In some instances like him, it can be due to trauma, but in other instances it has to do with things like food insecurity or housing instability or having caregiver burden from being a grandmother taking care of 9 grandchildren. The poor health outcomes in the neighborhoods around our very own healthcare institution was part of the impetus for creating the Impact Community Health Worker model. The concept of community health workers isn't new. It's this idea that people who share life experience with patients are very well positioned to support them through their healthcare journey. But the approach to designing the model was unique. Part of the way we designed the program was to look at historic limitations from other community health worker programs, unfortunately, most of which had been unsuccessful. And it turns out that they failed for very predictable implementation reasons. Things like not hiring the right people, not having the right kind of supervision support, not figuring out the right balance between having community health workers work in clinical settings, but also spend time in the community. And so we set about this process of designing a very intentional and standardized community health worker intervention that could be scaled. As a result, when Mr. Brenner was in the hospital, he got connected to Ms. Cheryl Garfield, who's one of our community health workers. They had a pretty informal conversation, and Cheryl asked Mr. Brenner a question that possibly sounded kind of unusual, but wasn't an accident. She asked him, what was the last thing that you did for fun? And it took him a minute to remember from his own life about the last time that he had fun, but what he ended up telling Cheryl was, I went bowling. And so that was the first thing that Mr. Brenner and Cheryl did when he got out of the hospital. They went bowling. He laughed, he remembered what it was like to have fun. Life started to have a little bit more purpose and joy, and that enabled him to want to continue working with her. They helped him get enrolled in insurance. He went to see a primary care doctor at a local community health center, and Cheryl was able to find him subsidized housing so that he could move out of the abandoned storefront where he had been living without any heat. And because of that timeline, from bowling to housing, in really just a few short weeks, Mr. Brenner went from 9 hospitalizations before he met Cheryl to just 1 in the 15 months after they worked together. One of the other things we did was test the Impact Community Health Worker intervention in a randomized control trial. In essence, we took over 400 Mr. Brenners, and we connected half of them to community health workers like Cheryl, and the other half got routine care. And the results were very good. Patients who got connected to a community health worker were 12% more likely to see post-hospital primary care. They improved their discharge communication between themselves and their nurses by 13%. They improved their mental health and their level of engagement with their healthcare providers. And we saw a 25% reduction in 30-day hospital readmissions. So the team was pretty excited. Not an easy thing to achieve kind of robust outcomes across the triple aim of health, cost, and quality. So the team started to think about what do we need to put in place to scale this both within Penn Medicine but also spread the impact nationally. And that's where the resources of the Innovation Center really came in. I think in healthcare there's really a very clear pathway for things like how you get a new drug from tested in the laboratory to taken over lunch with food, of course. But for something like this, it's not often as clear what the path forward is. And the other issue is oftentimes you don't necessarily have the right people on your team. At the time, our organization was a physician researcher, the founder of the program, Dr. Shreya Kangovi, a master's level social worker, and 5 community health workers. So that's exactly the right team to design and test a community health worker intervention, but those aren't necessarily the people that are going to help be able to answer this question. And that's really where the Innovation Center came in. So we were really lucky to get connected to a very talented team. We got design support, individuals who could help us think about how do we translate what we've learned about a community health worker intervention into very easy to read manuals for community health workers, for their managers and program directors. They helped us build a web presence so that we could push out information that we learned to help other organizations avoid those implementation barriers that I mentioned before around hiring the wrong people and not figuring out how to effectively communicate with care teams. We got connected to experts in technology who helped us build what is, in essence, case management software for community health workers. So really easy to use software where CHWs can document their work with patients, but it also links to various types of electronic medical records, so care teams know who's connected to a community health worker and what they're working on. And we can pull real-time data like hospital readmissions so that we can do data-driven performance management. The other thing the Innovation Center helped us think about was what's our value proposition, both within the organization here at Penn Medicine, but also to the vast array of organizations in the national healthcare landscape, which range from federally qualified health centers up to billion-dollar healthcare organizations on both the provider and payer side. They interviewed different organizations to help us figure out what are the right kind of offerings to help these different organizations across the country avoid reinventing the wheel and be able to learn from the tools and technology we had developed here at Penn. So I'm happy to say that we have more than 1,000 organizations across the country have downloaded this toolkit that we've developed to help organizations either start or improve their community health worker programs. And we've worked with 20 organizations across the country, from Maine to Texas, giving them advice about how to hire the right people so they can achieve what we've been able to, which is a less than 2% turnover rate in the community health worker role, and also thinking about what infrastructure they need to build, as another example, to help community health workers balance their mix of clinical and community time, and also how to think about setting up an evaluation system so that they can be able to document their outcomes in order to demonstrate a return on investment. As an organization, we've continued to do research on our own program. We've conducted 3 randomized control trials of the Impact Community Health Worker model that have showed continued effectiveness in improving chronic disease control, mental health, quality of communication, and reductions in hospital admissions of 30%. We've taken those outcomes and put dollars behind them so that we've been able to demonstrate to Penn Medicine a return on investment of $2 for every dollar that they've invested in the program, which enabled us to scale up at Penn to the tune of being able to connect over 6,500 patients to an Impact Community Health Worker since the program started. Looking ahead, we want to help more organizations use the tools and the training that we've developed so that we can help other organizations, again, start or improve their community health worker programs. And probably just as importantly, we want to give them our impact seal of approval. We want to be able to verify that they're community health workers and supervisors, and in fact, the program itself are using our tools and best practices to improve programs for the betterment of patients. On a personal note, I actually was hired in the position that I have as a result of the innovation grant. So of course, I'm eternally grateful to the organization for giving me a job that I really love. One of the greatest moments of my month is we call patients, and it's so wonderful to read what patients have to say about getting connected to their community health worker. Oftentimes they say things like, this person is my mentor, they're my coach, they're my lifeline. One person actually said, literally, my life was falling down around me, and then I got connected to a community health worker who literally saved my life. So it's a truly meaningful program at the patient level in terms of being able to help people focus on their health and improve their health outcomes. And because of the infrastructure that we've been able to build and the return on investment that we've been able to achieve, we're able to expand that to more and more people here in Philadelphia and nationally. Thank you.